joining us at today's Great Challenges live event. This is part of the Great Challenges program, which is sponsored by the Robert Wood Johnson Foundation. I'm Sally Squires, and I'm going to be your moderator for the next hour, and I'm delighted because we've got a fantastic lineup. And just a little bit about me, they asked me to say this, that I've got a graduate degree in nutrition. I spent more years than I care to remember writing about nutrition at the Washington Post. And these days, I'm also the head of the food, nutrition, and wellness practice at Weber Shandwick. And I blog for everydayhealth.com on something called Perfect Portions. So I'm really delighted to be here. And the goal today is to really look at one of the most complex problems that we've ever had and in health or medicine, and that's of course obesity and shopping, and how do we deal with what do we need to do what are the magic bullets that we need to find to help combat this problem. So today, as we explore obesity, we've really got a stellar panel, and we're going to look at the way some groups are gaining momentum to build healthier communities. And we're going to take questions from viewers on social media, so I hope you're all going to be sending those in. And please tag your questions with the hashtag Great Challenges. So just a reminder, hashtag Great Challenges, and that will get you right into the middle of the conversation. So I want to introduce a terrific panel, and we have with us Melissa Halas-Liang. She is the founder of Super Kids Nutrition, which helps prevent and reduce childhood obesity by saving the world one healthy food at a time. So welcome, Melissa. We also have Sue Bora. Sue is a registered dietitian, and she's not just a registered dietitian, she's also a past president of the Academy of Nutrition and Dietetics, and these days she is the senior vice president of communications and strategic planning at the Food Marketing Institute. Sue's going to give us a great report on a new shopping for health study that looks at what are consumer attitudes as they're going through the grocery store and they're shopping, and I can hardly wait to hear more about it. And then we have Steve Hill, who is the chief of staff for Oklahoma City Mayor Mick Cornett, and I'm really pleased that I got to meet the mayor when he was at the U.S. Conference of Mayors in Washington last January. He's a busy man. He's also been talking about what he's done with Oklahoma City at TEDMED 2013, and what he challenged the city to do after they were listed as one of the fattest cities in the U.S. He challenged the city to go on a diet. And that's what he talked about at TEDMED 2013. So Steve is going to update us on the latest innovations within the city, and I think he's going to proudly tell us that Oklahoma City is no longer on that fattest cities in America list, thanks to what they've been doing. So welcome to everybody. It's really great to have you with us. And we're going to start with this question for Sue, but I just want to remind everybody, do send in questions that you've got. We've got a few in the queue, but we're really always looking for more. So for Sue, I'd like to ask about the study that we talked about just a minute ago, which is Shopping for Health. And it really is examining the world of what consumers experience inside the grocery store. And I'm hoping you could tell us, what does the typical shopper think about, and how do they behave when they're entering that grocery store?
Well, thank you, Sally, and I'm delighted to be here today to share some perspectives from that retail food marketplace. Food Marketing Institute is the organization I work for, and we represent all the nation's supermarkets, and where people are making most of their, many of their food decisions every single day. And to set the stage for understanding what's happening behind health and shopping, it's always important to know what are consumers doing nowadays as it relates to food shopping. First of all, we know shoppers come to our stores quite often. 1.6 times per week they visit our stores. That's a lot of consumer contact. We see them a lot. But once they get that shopping cart into the store and they're starting to move it around and make those decisions, they have about 38,000 different items on the store shelves that they're choosing from. So they're trying to figure out what is best for myself and my family in terms of health and nutrition, as well as lots of other shopping decisions. even before they got to the store, they looked around their neighborhood to say, well, what store am I going to shop at? And they told us there are 4 things that really impact what they choose their primary store to be. They're looking for stores, number 1, that have low prices, which in today's economy is understandable. They want it to have high-quality produce. They want high-quality meats. And they want a great product selection. So this is what they're telling us is making their decision, even what store to walk into to begin with. So now let's look at what they say about health in their shopping experience. In our study that we did with Prevention Magazine, Shopping for Health, shoppers told us that they really believe that they now know what foods are healthy and what foods are not. And when we did these types of research a couple of years ago, there was lots of confusion. What's a healthy food? What's not a healthy food? And we're finding that that confusion is starting to go away. However, even though they know what's healthy and what's not, we're finding that they have key barriers to eating healthy. What they told us is stopping them from eating healthy. Number 1, they think it costs too much to eat healthy. And number 2, they tell us it's really, really hard to change my eating habits. It's really hard to make those decisions. So with those things in mind, I'm really delighted at one of the trends we're seeing in the retail food marketplace is many supermarkets are hiring registered dietitians on staff. And really the goal of having a dietitian working with a retailer is to help consumers overcome their perceived barriers. So they can tell them how to eat healthy and not have too high of cost, or how they can try a lot of different foods that can increase their health. I'm also delighted to share that in our retail membership, our supermarket companies, over 90%, almost 90% of all our members, all our retail members, told us that they're using consumer health and wellness in their own competitive marketing strategies. So they're looking for ways to improve that experience for their customers around health and wellness in their stores.
So that's great stuff. I mean, and very interesting. What part of that were you most surprised about?
I think it was good news to me to hear that they feel they're less confused about what's healthy and what's not, and we've seen a lot of trends towards that as well. I think I'm still struggling as a registered dietitian to understand how we can help people understand it doesn't cost a lot of money to eat healthy, and how can we get over some of those barriers.
So, and that's a really interesting just question that I think we're going to probably explore throughout this hour. So, Melissa, as we look at the Super Kids Nutrition that you offer, and I know that you do some toolkits that help parents figure out ways to really teach and encourage healthy food choices. And you take, as I recall, you take kids through and families through grocery stores to teach them how to shop. So really, what are you seeing as consumers are going through these stores, and are you finding changes in how they approach grocery shopping?
I definitely am. I have to agree with Sue. I mean, it could be because we're both registered dietitians, but I find that, you know, in the past we saw a primary focus on sodium, and now I'm seeing an increased interest in whole grains, which has definitely helped. And when I walk parents and families to the grocery store, I think, you know, they're looking some more at the ingredients than just the food facts, but I'm still seeing a deficit in knowledge about, for example, if they're choosing cereals, they don't know what constitutes a healthy cereal. And so I find I have to tell them, well, you know, less than 6 grams, or less than or equal to 6 grams of sugar per serving, that they still need those hard facts. One of the tools that I actually encourage is Fujicate. It's Food You Kate, and it's an app, and I've used that with kids, and they go around and they scan all the foods, and I tell them if it has a B- or better, then for cereal it's good, while educating the parent to say, hey, look not just at the sodium, but look at the total grams of fiber. You know, look at the grams of sugar. And then I think people are becoming more aware of color, so that's a great teaching tool. I'll often say, you know, to kids and families, and even adults who I just take without their kids, focus on trying to get 4 colors a day. And the colors can be a brown or purple rice. You know, it can be an orange sweet potato, purple eggplant, or citrus at breakfast. And that if they start to aim for more whole foods of 4 colors a day, what ends up happening is they end up having more color diversity in their diet over the course of a week. And then again, you always have to focus on taste. So I tell them, look, if you're going to try a new food, introduce it with a food you already like, and that's going to increase the success that your family is going to enjoy it. And I think, you know, it really is just about, in the end, they'll try new foods, but sometimes parents will pass on their food prejudices to their kids. So you have to tell them, look, you didn't like olives as a kid. You might love olives, or you're not fond of artichoke hearts. Your kids might rave about them. So again, try to have your kids encourage you to try new foods and try those new foods with them.
And as we know, it takes at least 7 tries, sometimes many more, for a child to really accept a new food. It isn't always just a slam dunk that first time. So Steve, I'm really kind of curious. Tell us about what's been happening in Oklahoma City. And I know the mayor put everybody on a diet, but it sounds like, diets don't always work because people slip back into their old habits, but it sounds like you've really captured something special. And what have you done, and how's it working?
Well, thank you, Sally. You're absolutely right. First, I'd like to give some credit to my boss. And if you haven't seen his TEDMED talk, it's available on Google Mick Cornett and TEDMED and watch it. It's very good. The mayor, about 4 years ago, put everyone on a diet. We showed up on some lists of the most unfit cities in America, and so he went out on New Year's Eve and just said, I'm putting the entire city on a diet. 4 years passed, and we had various mechanisms to gauge results, but people signed up and they charted the weight that they lost, and eventually the mayor promised we were going to lose 1 million pounds. And so after 4 years, we celebrated the fact that we lost 1 million pounds. Now, while we're excited and thrilled that over 47,000 people participated and lost that weight, the real value of the program was as an awareness campaign. And to that end, we were extremely successful. Probably the reach in Oklahoma City is 100%. I don't think there's anyone in town that A, is not aware that the mayor put him on a diet, and B, that it was a fairly successful deal. The one aspect of the diet that was a little different from what you often see is a lot of times when government gets involved in this type of things, we tend to lean towards exercising. Well, the mayor's contention was that everybody needs to exercise, and it doesn't matter what weight range you're in, that you need to exercise. And so he really focused on it's a matter of what you're eating and how much you're eating, and that was the message that we try to drive home. Now, I mentioned that 4 years passed and we hit 1 million. The Rachel Ray Show had Mayor Cornett on TV to kind of celebrate that, and while he was in New York City, he went to Men's Fitness magazine for an interview. Now, Men's Fitness is the magazine that actually put us at, it was called the fattest and fittest cities, and they had us pretty high on the fattest cities list 4 years prior. And so as the mayor was sitting there waiting for his interview, he looked down at the coffee table, and lo and behold, the new issue was there, and so he picked it up and he thumbed through, kind of expecting to still find us on that same list, and we weren't. And so he flipped over to the fittest cities, and there we were on that list for the first time in recent memory. He likes to point out that we're not under the impression that you're going to come to Oklahoma City and see streets populated by supermodels. We still have a little bit of work to go, but I think we're headed in the right direction here.
Well, and as I recall, what he also did that was so remarkable is, one, I think he's a former television caster, as I remember, so he's got great presence on camera. And then I think he launched this whole event at the zoo, didn't he? Standing in front of a cage of an animal that was kind of overweight.
Well, the zoo, he did it in front of the elephants, and the zoo people will tell us that the elephants are not actually overweight.
Overweight, I know.
They're supposed to be that big. but yeah, you're absolutely right. We really benefited, and we fielded calls from all over the country on, how do you replicate this type of awareness campaign? And one asset that we had is that the mayor's background is in television, so he's very good at communication skills. He's also very good at branding, and so he was able to combine his particular talents and make that part of the campaign, and that was a large portion of why we were successful with it.
Well, and I think you had fun with it, which is also really great. So we have a question from someone in the who's put this in the social media community, and this is from someone named John Cox, and I think he raises something that lots of us think about, which is, how do you sift through all the conflicting information that exists on what's a healthy choice? And he notes in his question that on the one hand you hear a certain study come out that says something's okay, and then the next time it's not so good. And he he points to this idea that we do get sometimes confusing messages, and in particular, he's very interested in the whole question of meat versus non-meat diets, and asks, where's the beef? So, Sue, do you want to start with that, and then maybe we could toss it to Melissa?
Sure, I'd love to take the first shot with that. So, as a registered dietitian, once again, I think there are lots and lots of different types of diets that all can be healthy. So that is the best news for anybody. I know everybody has their favorite diet, and sometimes what's your favorite gets in the way of understanding what's really healthy. So there's lots and lots of good ways to do it. And I can show you a diet for a meat eater that's an extremely healthy diet, as well as a diet for someone who chooses to be a vegetarian can be an extremely healthy diet. So I guess the good news for folks is that there are lots and lots of approaches to diet that all can be healthy and all can be extremely different. So that's what's good about being able to eat lots of different things and have great foods in your diet for a healthy diet.
Yeah, and just one quick follow-up on that before we toss it to Melissa. So does the fact that more and more grocery stores have registered dietitians is in the, so I don't know if they're always walking the aisles, but they're present, is that potentially going to help people, they've got a place they can go while they're shopping to say to someone, what do I do? What do I think here?
Absolutely, and that's what dietitians do, is they look at, they say to you, okay, what's your favorite foods? What do you like to eat? And I can show you how to build a healthy diet just around what your own personal needs are, and that's the beauty of that.
So, Melissa, what do you think about John Cox's question? What would you advise?
I definitely have to agree with Sue, and I would say you don't have to give up any food group to be healthy and have a healthy diet. And I think sometimes what we see is this lack of really understanding what moderation is. And, we see the excess portion sizes, we see meat as the center of the plate, where it really should be a complement. I think one thing that probably all health experts could agree on is that most Americans aren't getting enough plant-based foods. So we need to see, an increase of fruits and vegetables and beans and nuts and more whole grains. So I would say you don't have to be vegan, you don't have to be vegetarian, and you don't have to be, totally always a carnivore. But you do have to find balance, and that all Americans, again, really need to up their color with less processed whole foods. Not saying all processed foods are bad, but just saying we need to increase more fruits and vegetables and beans.
So you're basically saying we need more of that flexitarian approach, right?
Yes, I would agree. I would agree.
And ironically, if we didn't have a government shutdown right now in D.C., the Dietary Guidelines Advisory Committee would be meeting and would be talking about some of these topics. So it'll be very interesting to see how that all plays out. So let's think about those people who are going into the grocery store. And we have another question where people are saying, okay, so I'm walking through the grocery store, and I know sometimes some of us will rush in because we got to pick up something really quickly, but other times there is a little bit more time. And I wondered if there are more details from that particular study that really reflect how we're shopping and what we could do better or what we need to know more about. Sue, I don't know if that's something you could address.
Well, and I think Melissa alluded to this earlier, is that one of the things this study showed is that people are finding things that they can do, the positive things that they can do to improve their diet. And whole grains is probably the best example of that. In our study, 50% of all the people we talked to told us that they're buying more whole grains than last year. And in fact, almost 3 summers ago, about July 2010, for the first time when they looked at a 52-week sales analysis of what types of bread were sold in 52 weeks, in that first year's time, the dollar sales of packaged wheat bread took over the sales of packaged white bread. This is some Nielsen data that we had an opportunity to look at. So that tells you that this is one of those great stories about what's healthier is now being accepted by the public. It's available in grocery stores, and it's now actually becoming the norm to eat healthier and choose whole grains. So that's one of the good news stories we have about this.
So Melissa, as you've helped families go through the grocery aisles through the years, is there one question that comes up again and again?
I would say one of the things that they're most surprised about, I don't know if it's a question per se, is when we review crackers. They're always so surprised when I show the ingredient list and that they see that there's all this added sugar in crackers. And, you know, I've seen kids, I just did a workshop with a couple hundred preschool educators and directors and owners in Chicago, and they, you know, a lot of the foods that they were offering, even if they were whole grain, had so much added sugar that was unnecessary. And I think they would say, well, why would they add sugar to crackers? That's what I hear the most once I bring that to their attention. And I say because it's going to digest easier in their mouth, it's going to be, they're going to want more and more. And I see kids, if you give them a cracker, a tasty cracker that has added sugar, versus a more Triscuit-like cracker that's got fat, that's a whole grain, they're going to tend to overeat the sweetened cracker. And that's why I say that's why they add sugar to it. So those are some of the tips that I walk through, is how to, you know, pick a healthy food and what constitutes it.
So Steve, in Oklahoma City, did you find that there were changes in how people shopped? I know we talked about exercise or how they cooked, or was the fact that the community was doing this together, did that make it a safer thing to do, that people said, oh, I want to be part of that?
Yeah, I think it did get to a large degree. It became a community event, and when you have, you know, weight is an uncomfortable conversation for some people, and so when you've got a lot of people talking about it, it becomes less uncomfortable. And we did some things along with the food items that made some sense. We took all the fried foods out of our elementary schools. We had some success, and the mayor's a big believer in partnering with the private sector for solutions, and so we had both Subway and Taco Bell worked with the mayor, and we highlighted their options that were, you know, better choices. And then we've had a lot of input from our local restaurants that they would develop maybe a mayor's plate, and it would be some of the food, the colorful plates that Melissa talks about. So we had a lot of buy-in community-wide, and it affected, to a degree, the types of food that were available to people.
Well, and you know, you raise another really good point, and we've got a question on this, that as you're trying to make healthier choices, someone named Anthony Harvey asks, when you've gone through the store and, you know, you could get these loyalty cards, is there any way to make those loyalty cards, or to sometimes offer even more healthy choices on the loyalty cards, or is there any interest or any stores that are already doing that, Sue?
Sounds like a really interesting opportunity, and loyalty cards, you can find a lot of information and resources that are targeted to you. So if it isn't happening now, let me tell you, probably after this conference, I'm going to see a lot of supermarkets looking what would be those opportunities. And if you as a customer said, please send me options for healthier choices when I'm doing my shopping, I think a retailer would be very, very happy to do that for you.
Well, and that also feeds into another question that we've gotten from Facebook. So Kathy Howell asks, she said that, you know, that are there any efforts underway to make organic foods, and actually I could think of some major chains that are making organic foods probably a little easier to buy, but she says, are there any efforts to make organic foods more affordable? And she says that the government wants us to eat healthier, but sometimes healthy food is more expensive than the processed kind. And I don't know. What does the panel think about that? Melissa, you want to start it off?
Sure. I mean, first I'd like to say that you don't have to equate organic with healthy. You know, although I have a lot of clients who will say to me, I want to eat more organic, but I'm on a budget, I might say, all right, well, let's just choose some foods that are highest in pesticides, and you can start with them. But I think the bottom line is that the most important thing, again, is that most Americans aren't getting enough produce, they're not getting enough fruits and vegetables, and that's the most important message, that they're not getting enough, and that the health benefits of conventional produce and grains outweigh the risk of pesticides. But having said that, I would still say if they can afford it, and it is in their budget, to shop wisely. You know, go to the farmers market, engage with your local farmers. I mean, we go on Saturdays, and there are plenty of generational farmers who will say, well, we're not certified organic, but this is our farming process, and you can purchase from them at a lower cost if you're concerned about pesticides. And the same thing with, really evaluating where it matters. It might not make a difference if it's an organic banana versus a conventional banana. To your individual health, it might make a difference in the health of the farmer. But to consider those things when you're purchasing.
So Steve, in Oklahoma City, how much did you engage? You said you did a lot of, you got a lot of the community engaged, including the private sector. And did that include farmers markets? Did it include, I know you mentioned some restaurants previously, but how did you really pull all these people together?
Well, everybody likes a successful venture, and as it became obvious that what the mayor was doing was resonating with the public, we had no problem with people wanting to become involved. About the same, I mentioned the restaurants and that type of thing, but about the same time, our retail mix changed a little bit, in that Oklahoma City was serviced by kind of your traditional supermarkets and grocery stores. And right about the time that this conversation ramped up, suddenly we had interest in and brought in a Whole Foods, several Sprouts markets, farmers markets sprang up here and there. So I think it did. I think people talking about it with each other and recognizing, A, that we had an issue, and B, we had something of a solution, got people interested and involved from all walks of life, from the private sector to the retailers to the restaurants. So yeah, I think having that community-wide conversation's extremely helpful.
So Sue, I'm kind of curious what you think about this. I mean, I love buying fresh fruit and vegetables, and I think it's great. But where we live in Washington, that's not always possible. I could think of a couple of years ago that if we were relying just on the fresh stuff that was locally grown, we would have not been eating much because we had 3 feet of snow. Yeah. But also nutritionally, talk a little bit about the advantages of frozen versus canned and even dried fruits and vegetables and other products.
Oh, absolutely. And the beauty is we have all these alternative forms available to us at all times. And every time I've talked to consumers or patients or clients, I've always talked about fresh, canned, or frozen. All nutritionally are just about equal. So look at what your taste preference is, what your budget is like, and you can certainly accommodate any of those forms in a healthy diet. So that's always a good message to get out to folks. I think
go ahead.
I think there's an impression that if it's fresh, it's better. There's a couple, when we were talking about the organic just a moment ago, there's a couple of words that people use with foods that tend to indicate to people, or people believe that means healthy, and it doesn't always equate with healthy. Right. Fresh is one of those. Organic's one of those. And then the newest trend that's out there is that local trend. So you're looking at buying local, and there is definitely an impression that if it's purchased locally, it has a health halo on it. All these things are fine, and they're excellent choices, but there's really no data that says one is nutritionally superior to the other. It's just a choice, and it's something that you want to do, and that's fine.
Melissa, do you find that there's confusion over these as well, and do you ever point to your families to some of the other options besides fresh in the produce or fresh produce?
Well, last week, when I had the opportunity to educate these preschool directors and chefs, one of the questions that they said came up on many occasions was when they utilized frozen vegetables at their Healthy Start preschool, that parents would be upset and say, well, why are you serving frozen vegetables? And so we talked a lot about frozen and fresh vegetables and how kids will often eat them actually frozen, and that you can get a child to eat frozen peas or frozen gourd cold, and they'll increase their vegetable intake. And the same thing goes for frozen fruit. And I was telling him it's often a great way that you can save money by buying bulk frozen fruit, and kids are more likely to try it if it's a cold treat. And I even gave the example of having a Bluetooth contest where the kids eat frozen blueberries and they can see whose teeth get the most blue. So I'm all for frozen fruits and vegetables.
I love that. That must, and then then you get to have a toothbrushing lesson afterwards. So that's great. Well, we have another question from social media, and in this case, this is directed towards Steve, and this person asks, reflecting on the campaign in Oklahoma City, a Facebook fan named Amy asks, She has seen the First Lady, Michelle Obama's, effort for drinking water in the latest campaign that she's issued as part of the Let's Move effort, and she said, really, does it take that kind of national bully pulpit to help make these changes? I mean, you've seen major changes in Oklahoma City because the mayor got involved. Is that what it's going to take to get even more traction? I know we're seeing some improvements in the obesity epidemic, but yeah, from your perspective as chief of staff to Mayor Cornett, do you think that getting officials involved in this way is really going to be important?
Yeah, I think it certainly doesn't hurt. Now, Mayor Cornett, one of the other aspects that he brought to the table, so to speak, was that he'd actually struggled with some weight loss through the years as well. He managed to drop 40 pounds, and he's a very public mayor, and so people saw that he had not only dropped the weight, kept it off. I think what the First Lady is doing in terms of the community gardens and the water and all that, I mean, it's very helpful. Now, she's got 313 million people that she's got to reach, and we had about a million and a half. So, you know, her audience is very diverse and difficult to reach probably in some cases. But the fact that she's the First Lady is I think is helpful to this situation.
So we've got another question from Twitter this time. This is from Stacy, and she asks, are stores or the food industry working towards new labeling standards to make healthy choices clearer for consumers? Sue, do you want to take that one?
Actually, there is a program that's being implemented across the country as we speak. It's called Facts Up Front. I know many of my supermarket retailers, along with some of the food manufacturers, have joined together to put these icons right on the front of the packages that give you a quick check on how many calories per serving, how much fat per serving, and that prime information people want to know about their food products as they're making choices. And you can go to your store now and look down the shelves and see a lot of these front of pack labels appearing on foods even today.
So that means as you're rushing through the store, you can make a better choice by scanning the outside of the product.
Right, and you have to turn it around to look at the back of the package. Yes.
Exactly. Well, and that's another question that feeds right into another question that someone on social media has asked. And I know this is also part of what the First Lady is trying to do with the Let's Move, is to make the easy choice, to make the healthy choice the easy choice, the default. And wondered what tips, Melissa, you have for consumers as they try to make that easy choice that healthy choice rather even easier.
Again, it's all about convenience. So they need to look at healthy foods they know aren't going to sit in their fridge and they're going to toss because they've expired. So, you know, even though sometimes a pre-washed salad or, you know, a rotisserie chicken might be priced a little higher, if it's going to encourage them to eat healthy at home and eat more meals at home, I think that's the first step. Some of the things that, of course, we see at grocery stores now is we're seeing more of these healthy convenience items. And so, you know, weighing the options. Sometimes I want to tell families, well, imagine your copay for type 2 diabetes. You know, a few dollars here and there, it's harsh, but sometimes, you know, with certain clients, it speaks to them to say, you know, where's your priority in terms of health? But in the end, it really, when they're grocery shopping, they have to see that immediate benefit in their busy schedules. And that's where it comes about educating on convenience and healthy foods.
Well, and I have to say, as I walk through the grocery store, I am always surprised at how you can now get butternut squash that's been peeled and it's diced and it's ready to go, or you can get mixtures of fruit and mixtures of vegetables that could be stir-fried. I mean, it's really like using the grocery store as your sous chef. And it is, and you know, cuts of meat that are already either marinated or they're, you know, done in some particular way, or seafood or any of that. It is really pretty remarkable for those of us who have been around for a little while. It's kind of amazing to see what's now available. So we have a question from George Washington School of Public Health, and it was mentioned on Twitter that children are more likely to overeat foods with added sugars. And well, the question is, how do you make healthy decisions while still managing to be a parent, a kind parent, and making sure that I think they're really saying that how do you walk through that grocery store with the kids, and they see probably a box of something that they want, or and you want to direct them towards something else. What do you do, Sue? What do you think that people can do as they're shopping, and what do you do with your kids?
Well, certainly as a parent, sometimes it's leave the kids at home, but anyway, we'll put that one on the table. And certainly it's a great education tool, is how I used it with my children, of all these choices that we have, and why should we make certain choices, and what are the decisions that go into these choices. And certainly I was one that they were allowed to pick a treat, and they could pick their special treat, so that they had their own choices to participate in as well. So I think there's a huge role for the parents to be the role models for their children, to help them learn what is in all these foods, and help them become good decision makers. As then when they're driving their carts down the aisle with their kids, they can be helpful too. It's sometimes difficult, but there's lots more information than ever before that can help you make these decisions. And there's lots of tools to help out, and I'm sure Melissa can share some of the stories that she has from working with these folks all the time.
Yeah, well, and I think it's great that a lot of grocery stores now have the little carts that I see mini shoppers.
Yeah. They're shoppers in training, right?
Yeah, shoppers in training. So, and Melissa, yeah, what are you seeing, and kind of what are your tips for going through the grocery store with kids?
Well, right now, Super Kids Nutrition, we're partnering with the American Institute of Cancer Research on this campaign to help prevent 1 in 3 cancers. And we created all these toolkits. One of the toolkits is healthy grocery shopping. And so we got to do some food tasting and bring recipes in that we developed, and we sampled them at a grocery store in Washington, D.C. And what I found is the kids would come up and they were interested. And sometimes the parent would say, oh, well, my kid doesn't like those foods mixed together. Or, oh, no, he doesn't like corn. And I would get down, at eye level and say to the child, do you want to, jump higher? Do you want to think your best? Do you want to run your fastest? These foods help you do that. And they all tried the food. I mean, foods that were touching each other and mixed together, which, kids don't like to do. And I think a lot of times it's how we phrase it. And for, kids who are a little more resistant, it's about getting them involved in the kitchen. I was really fortunate. My mom flew out this weekend, and she cooked the whole weekend with my daughter. And, I mean, my daughter's a pretty adventurous food taster, but there wasn't anything she did not eat on the table. And I think it goes back to we really need to get cooking with the kids. And so it's not overwhelming. Choose easy recipes that set you up for continued success. 5 or 6 ingredients, so you're not, oh my gosh, it's so stressful. You're pulling out everything from your pantry and cabinet. Keep it simple. And again, going back to that, introducing new foods with kids, and that foods that they already like, or foods that your husband or partner like. And I think that sets you up for success, those tips for sure.
Those are great suggestions. They really are. So we have another question, and this one comes from Vanessa, and she asks, is there any evidence on the positive effect of posting calorie counts and nutrition information in restaurants? And in particular, Steve, she wanted to know about that mayor's plate that you talked about in Oklahoma City. Did you find that when restaurants tried that 1, people were more likely to eat it, but 2, I don't know if you're yet posting calorie counts on menu labeling. I know that's becoming a national law if it isn't already in effect, but it's kind of rolling out, and wondered what you're seeing with all of that.
Yeah, we've got some restaurants in Oklahoma City that do that, and I think probably most don't. The mayor's plates tended to be popular because the perception of what was healthy changed a little bit during that conversation, and people I think our state food is a chicken fried steak, and people came to realize that that's not the best thing to put into your body. In moderation perhaps, but if it's a staple of your diet, you're probably headed down the wrong path. The mayor's, again, back to Melissa's point on the colorful plates, that's exactly what the mayor's plates tended to be at these restaurants. They were well proportioned, and and tasty, back to the other point. So yeah, we saw some success. I do think that the calorie, and I'm speaking completely without any kind of authority here, but I do like the idea of the calories being put on the menus. And I think personally that would have an effect for me, and I assume it does for others as well.
Yeah, I mean, I could say that even I remember being in Atlanta at the CDC a few years ago and going into a well-known chain that was an early adopter of the calories, and really it did help guide choices, because I looked at one thing and went, oh no, I don't think I want to do that, but something else, and it is really helpful. So I think that's terrific. So I think we've gotten another question about shopping and just about how, as you're going through the store, I know it has sometimes been said that, and I don't think this is true anymore, but I think there was a famous author who said, shop on the outside of the store. But I always contended that if you did that, you'd miss the things that were in the middle, like the dried beans and the olive oil and a lot of the other really good stuff. And I wondered for each of you, because you're very involved in this whole field, how do you shop? What are you doing, or what are some of the tips that you would be without? So Melissa, I don't know if you want to jump in there.
I love shopping. It's a grocery shopping. It's a family event. we get into it because I'm a foodie, so of course. And my little daughter's on her way to becoming a foodie as well. So when we go to the grocery store, we probably should start with the dry foods from a food safety standpoint, because we're there for a while. But we always start with the produce, because I'm drawn to the color. And I do look at, okay, well, if we're getting red apples and red grapes, we need to get orange citrus. We need to get white bananas, because I teach functional food, so I think of every food as how does it protect your body, from different diseases. And so, of course, my daughter will be like, oh, well, we need blueberries to protect our skin from UV damage. I'm a little scientist in the mist. So we always start with produce. And then, meat and cheese is usually last, in dairy. Although I am a big cheese lover, I have to watch how much I buy. And I try to always remind myself it's the accent to a nice dish of quinoa with raisins and nuts, and then maybe some feta to give it that different kick. I think one of the things, as a dietitian, it's easy for me, but I think with my clients, the biggest misstep is the lack of planning. When they go to the grocery store, I do think it's helpful to have a list. I think that they should have a few meals in their mind that they're going to cook that week, and that can help avoid impulse buying, which of course my husband and daughter are susceptible to.
Yes. So Steve, do you do the shopping in your family?
I tend to do quite a bit of it, and I'm appreciative that I got the chemical breakdown of a cracker, because that explains the amount of money I'm spending for my 15-year-old to eat sugar. But yeah, and I think the planning thing can't be overstated, because if you don't know exactly what meals you're going to make, you wind up buying snack food, basically. So you buy the stuff that you might eat between a meal. So I think, careful planning and then buying sensibly. And it kind of goes back earlier, we were talking about, how do you get your kids to eat properly at home? Well, part of that, I would think, would be the parents need to realize it's kind of garbage in, garbage out. So if you fill your pantry with bad foods, that's what your kid's going to eat.
Oh, that's right. So Sue, do you always shop with a list?
Actually, I do both, with a list and certainly impulse buying. But I think this just leads to is what I know that some retailers are doing to try to help their customers navigate the supermarket, if you will. And lots of dietitians are doing what we call healthy eating store tours, and they'll take you to every department and show you, how to read labels and what's the healthier choice, and how to mix those dried beans with your fresh produce over on the other side, and come up with easy, healthy, economical dishes. So I think we're going to see a lot more tools like that, especially to think about the apps that we have available to. I'm going to guess we're going to get more apps on how to easily navigate that supermarket and put your meal together and walk out the door ready to go. But pre-planning is indeed a key. That's something that most of us don't do.
So one of the things that I love about the new grocery stores, or as grocery stores are evolving, are the apps that the stores themselves are giving, where you can actually, in one of the stores in DC, you can download an app and actually check out you can scan the stuff as you're going through and make it even a little bit faster to get out of the store, as long as the Wi-Fi works throughout the store. But you can do that. And one of my tips is that I find I'm cooking vegetables on the weekend and then putting them in, like braising cauliflower or Brussels sprouts or different things like that, and then having them ready and pre-cooked, slightly pre-cooked all week, that then they could be, you could add other things like, Melissa, I think you mentioned with quinoa, raisins and some other, nuts or whatever that really makes them delicious. So I think there are some really interesting things that are happening right now. So we have another question, which is someone asks, are there any grocery stores that are out there besides Whole Foods that are actively creating wellness programs? And how are they starting, and where are their resources to do that? Sue, is that one you might want to start with?
Absolutely. And because we represent the entire retail food industry with our members, I can tell you that when we talk to all our companies, supermarket companies are out there, almost 90% of the companies feel as they are investing in ways to help their customers meet health and wellness goals. And it's anywhere from hiring a registered dietitian to having shelf label information to, as I mentioned, the store tours. Almost every single grocery store website now has a health and wellness part of the website, and you can go there and find out what's new in health and wellness and their product supply. Healthy recipes, healthy meal ideas, healthy planning ideas. So I think that it's growing everywhere, and I think you're only going to see it grow more in the future.
So Melissa, are you seeing health and wellness in I think you're based in California?
Yeah, I'm in LA, so I mean I think we're pretty ahead in terms of health and wellness, because gosh, I mean I was in clinical for a decade before I was with Kids Nutrition, and I remember supermarket dietitians then. So I had one who was going in every day and doing nutrition counseling at a major chain. I remember even on the side on the weekends, I used to see clients and taking them on grocery tours, and then finding out, oh, there's a dietitian on staff at the grocery store. So I think it is a trend, and it's such a fantastic way to reach consumers. Along with all the other things we need to be doing, like taste testing, having recipes out in the produce section that are 5 ingredients or less, that are easy, that encourage, families to cook with their kids.
Well, and actually this month we're going to see the Academy of Nutrition and Dietetics are going to get together, and one of the groups that is growing so quickly in one of the practice areas growing so quickly among that group are the dietitians who are in grocery stores. Mm-hmm. And that kind of, I can remember being in Texas on a book tour and actually going to a place that a central market that really was becoming like a place for a community center in many ways. And it sounds to me, Steve, like what you've done in Oklahoma City is that you've really made changes in public policy that are helping to foster these health and wellness efforts. So tell us a little bit about that.
Well, yeah, we realized that the discussion extended far beyond just diet, and you start to look at your city and how it's designed and how people interact with the community, and you realize that maybe we're not doing, as elected officials and people that run cities, maybe we're not chipping in what we should be doing. So in Oklahoma City, I think as a direct result of the conversation we were having, the people actually voted to pass a penny on the dollar sales tax as a start and end date, and we're investing about $1 billion in dramatically altering the city. For instance, 180 acres of our downtown urban core streets we've reimagined and redesigned. So we've made them more narrow, we've made the sidewalks wider, we've added trees and landscaping, we've added bike trails, and we're trying to create a city where an active lifestyle is welcomed. I mean, some of the other things we're adding, senior wellness centers throughout the city. We're building a 70-acre park downtown. We have a whitewater rafting course that's in design right now and will be completed by next year. So I think there's a way that this conversation, like we're having today, filters up to your elected officials, and they take a second look at how a city is designed. And because whether it's urban farming of some sort, there are things that we can do that we're not doing that will help further this conversation.
So in Washington, you wouldn't necessarily think of us as a farming area, but in Washington, we're actually doing vertical farming, as you know, on rooftops, on balconies, different places like that. And Melissa, what are you seeing in terms of policy, and how does what you're seeing in LA fit with what Steve was talking about?
Well, I think one of the things that's really cool is that you can, online find out where all the local public gardens are. So really, I mean, right out on my front lot, next to the sidewalk, if you have a fruit tree and it's on city property, that's mapped out and anybody can come and get your lychee fruit right off your front lawn. So, I mean, we're seeing that. I really would love to add on to Steve. I think what he's really saying with these policy changes is that we need to see health become a #1 priority. And I'm really fortunate that I get to work with all income brackets. I see and work with families with food insecurity, and I see families who have all the money that they need, and they're purchasing sliders and giving their kids chicken nuggets every night. And what we really need to see is that health becomes the new social norm, kind of like how now, I mean, my daughter sees a smoker a mile away, and she's like, I can't breathe, and if we're seeing tons of junk food out at a party, that, she would be the one who's like, where's the healthy food, and we need to try to see that shift, and by creating something as simple as bike routes, walking to school programs, these community gardens, it's all a step towards making health a #1 priority.
Well, and actually, I'm pretty proud of the district. One of the things we've been doing is our shared bikes that are shared. We've been one of the leaders in that, and it is amazing how many people you see who are both from tourists to people who live and are now commuting on bikes. It's another side of the equation. We're talking about the food side, but as Steve and all of you have said, really, is we also have to focus on the activity side. So we're hard to believe, but we're almost through the hour, and we're down to pretty much the last question. And so with the great challenges discussions, we've centered around a lot of issues that aren't going to be solved in just with the snap of a finger or in a one-shot solution. And so we know that it's going to take a lot of these small steps, kind of like it takes a village to raise a child. We're going to have to take a lot of small steps, and that's something that even the Department of Health and Human Services has said, that all these things have to change slowly so that we can all be healthier. So this is the question that I hope you'll ponder and answer, that with so many critical issues really driving the complexity about this topic, what do the three of you think are the best places to start focusing our attention? What aren't we doing yet? And what are some of the things that we could do to see more improvements, like we've been talking about, in the short run, so that we can really build momentum and continue to make great strides against this awful disease? So, Melissa, do you want to start?
Sure. I mean, I think one of the best places is schools. Actually, in a couple weeks, I'm giving a bunch of workshops to parents and kids. This is a place that they already feel comfortable. They're either already doing drop-off or pick-up. Not to put the burden on the schools, because they already have so much on their plate, but it really is almost like a community center. With busy lives today, you don't see as many other places that people are going to every day or being involved in. And in addition to government programs, like in California, we have Harvest of the Month, where they would go in and have kids try different fruits and vegetables. It's just such a great place to start change, whether it's your PTA or it's an assembly or a workshop. Parents and kids are listening when you're there, and you make it in a fun, engaging environment.
So, Steve, what's the next thing you're going to try to do in Oklahoma City? What are your small steps?
Well, I agree with the school thing, and also, the idea that you have a conversation, that you have a citywide or a community-wide or a countrywide conversation, so that everybody's on the same page that this is a critical issue facing not just Oklahoma City, but every city out there. And one thing we realized was our community was built largely for cars, and so when you build a community based around cars, you wind up with fast food restaurants, you wind up with unfriendly streets, you wind up with fewer bike lanes and hiking trails. And so we've readjusted our thinking here, and we're building a city now not for cars but for people. And I think that in the long run, that's going to be what we do that's going to be most effective.
Those sound like terrific things that you're doing, and Sue, maybe you can kind of bring us home on all of this. So if you had in the perfect world, what would be the small steps that you think are achievable now and we can do?
Well, if you look at all these opportunities, what Melissa's having conversations with people that are helping them understand the importance of health, and cities like Oklahoma are making that a priority so that people are starting to recognize it and ask for it. And believe me, a supermarket is going to be there to answer the questions. Supermarkets provide customers what they ask for. So if they're asking for health and nutrition, and they're asking for information, and they're asking for all these things, I guarantee you every supermarket in America is going to accommodate that. Those of us, my colleagues here who work in the health and wellness area for the industry, we look at the fact that we believe supermarkets have a huge opportunity to be a health and wellness destination in their communities. They are in every single community. People come to us almost twice a week, we have pharmacies. We now have dietitians on staff. Think about the opportunities to not only buy wonderful tasting healthy food and making healthy diets and getting your prescription filled and understanding how to eat healthy or maintain your diabetic diet could all happen in a supermarket environment. So those are the things I'm looking for, that the supermarket will be a supportive partner in all of this as consumers demand more and more healthy choices.
That all sounds great, and it actually sounds kind of exciting that maybe we can. I mean, we have achieved a lot. I know there's a lot more to do, but it is pretty interesting that we have literally thousands of options now in grocery stores, and we do know so much more about nutrition than we've ever known, and just if we can help people remember how to cook, who knows what we could achieve. So it's hard to believe, but we're close to, we're really at the end of our hour together, and I can't thank the panel enough. Melissa Halas-Liang, Sue Bora, and Steve Hill. You were terrific and really enjoyed having you in this conversation for this hour. Just want to underscore for those of you who are joining us now and maybe will access this later, that we're going to tweet the Shopping for Health report link on TEDMED. So again, we'll be tweeting the link for this great report that we've been talking about today from the Food Marketing Institute and Prevention Magazine. And this will be on TEDMED, so look at the Twitter handle at TEDMED. The password that you will need, and I'll repeat it a couple of times, is FMI for Food Marketing Institute Prevention for Prevention Magazine, and it's all lowercase. So just one more time, look on the Twitter feed at TEDMED, and the password is F as in food, M as in marketing, I as in institute, prevention, all lowercase, and you'll be able to access that. So we also want to encourage you to continue to jump on the community pages to keep this conversation going. That's the beauty of social media. We we can stay in this conversation. This is one of the things I love actually about social media. So you can join us on Twitter at that hashtag, which was #GreatChallenges, and we really like to have a strong conversation. So keep weighing in and giving us your thoughts. Also want to highlight that the next Google Hangout is technology and health cost transparency. If there was a topic ever that was timely, I think that would be one of them. And so again, that's the next Google Hangout, is technology and health cost transparency. That's going to be on Thursday, October 10th at 2 p.m. Eastern. So mark your calendars. Again, Thursday, October 10th at 2 p.m. Eastern. We'll be joined by our health cost team members who will explore the latest efforts to increase cost and pricing transparency in healthcare. Really look at how those costs are a problem and what efforts can be done to help control them. So I want to thank the panel again for your time, your thoughts, your great expertise. It's been wonderful to be with you, and of course want to thank the vast TEDMED community, the team members, and Robert Wood Johnson Foundation, without whom none of this would be possible. So they make the Great Challenges program. They are the funder of this and allow us all to have these thought-provoking conversations. So thanks again to everybody. Hope you have a healthy and safe afternoon and eat well. So thank you.
Thank you.